OSF HealthCare System is almost a 170-year-old organization. We have 16 hospitals in central Illinois as well as in Michigan, and we have over 150 locations, outpatient facilities. Our mission is to serve with the greatest care and love in the communities that we represent. We are shifting to more using data as a means to connect with our patients, personalize the experience, and also help with some of our operations in terms of being efficient in their processes. Data analytics is foundational for a lot of the digital programs because we are identifying cohorts of patients through data for intervention. We have almost 150 different features that we've built out that we use to risk stratify and predict which patient population would be right for which remote patient monitoring program. And once they are enrolled, now we have data constantly coming in. So we might find that a patient who had a higher level of remote patient monitoring and care, their chronic condition is probably getting managed better. So maybe they can come down in terms of level of care, right, at a medium tier or a lower tier. A lot of downstream health outcomes is connected to social determinants. We've been intentionally looking at the data and seeing how we can provide compassionate care. One of the care models that we recently deployed was what we call as modern OB. Because we serve in mainly rural communities, lack of access to obstetrics and gynecologists, and also some of the underserved population would not have the time to be able to get the appointments. So using data as a means to surface patients that are pregnant or that have just delivered a baby and encourage them to be in a monitoring program. And we've seen amazing results in some cases where we prevented some really bad episodes happening to a patient because there was data to connect to us. Teradata is used for data harmonization, identification, analytics. Some of our AI models are running on top of it. It's a decade of data. So all of that is really helping us, right, in enabling all of these digital care models. The feature functionality within Teradata where we can integrate with third-party systems through a much more open structure, right, has really enabled us to elevate the capabilities of the organization. A lot of our predictive as well as risk models are running on Teradata's Python models, and having it run right on top of Teradata is much more efficient in terms of speed and performance. It's a very reliable system. So embedding within Teradata creates that reliability, and because some of these models, clinicians depend on it. So making sure that information is available is very critical, and as much as possible, layering all of that within one ecosystem or one environment, definitely increases the reliability and flexibility for us. When we invested in Teradata, the goal was to have our data engineers not be managing data, rather engineering and getting value out of data. We don't have DBAs, right? Everyone is working on data, being knowledge workers and designing solutions, data products. And I've seen that's the reliability that we get out of Teradata in terms as a system. We've seen by being more proactive, right, using data to identify, we've seen a 520% increase because we are doing a targeted outreach in patients aligning to whatever they needed to do in terms of their care protocols. Data is so impactful. Data with compassionate care gets so impactful for taking care of patients and their families.